Hi, I'm Chris Martin, President and CEO of United Way of San Antonio and Bexar County. Solving our community's most critical issues is something that we are extremely passionate about and invested in. Over the past 6 months, we've brought together experts, community leaders to examine and identify the challenges people in our community face. We are using the latest data and examining emerging trends as we research the best possible strategies to create lasting impact. You're about to hear from some of the strongest voices in our city who will speak to the challenges that people deal with every day in San Antonio and Bexar County.
What is most concerning to me are the cases of chronic abuse or neglect where the signs are just not being seen. You know, we need to have those conversations in schools. We need to have those conversations in our communities. I'm more concerned with serious ongoing abuse or in particular neglect because that is so hard to articulate. And I think there's also sensitivity there where you have to look at, is this child unclean because there's no one taking care of them at home, or are they having that issue because the parent is out working trying to provide for them? I mean, we can't confuse aspects of poverty with aspects of neglect.
And when parents don't have access to mental health support, how to respond to stressful situations can be difficult.
I know that currently we're removing less children than we used to for abuse and neglect, but it's important to note that they've also made it harder to remove children. The higher burdens that we've put on it is that swinging the pendulum too far where children are being left in dangerous situations. I also think that during the pandemic, we had a lot of child abuse that went unreported, where you would recognize that a child's behavior might not be misbehaving. It might be something that happened that had caused them to start having this reaction. When there's a family that's affected by that, we need to step in as a community and surround them with help and with resources and not duplicate services, but make sure that we're really coming together and not siloed in our areas. I think we need to continue to work together. Ideas like building a multidisciplinary team, and that's the model the Family Code, wants you to use. You use your advocacy center as your hub, and you bring in all the partners.
Here in Bexar County, that's really our goal, is to connect families to resources so that they can address their child's needs. They can ensure that their child is safe and in a loving home.
But when we don't even have the basics of access to health care, places, physicians to go see, places to get a pregnancy test, and that's when we talk about those lower socioeconomic areas that don't have access to health care, that maybe the family has one car and transportation to even the visits that they do have is challenging. As we know that when you give birth, it's a very stressful time. And what helps the mom and the mom's health and the mom's ability to do the right thing during birth is that trust with their caretaker. Women of color, especially African American women in the United States, historically have not been treated very well in general by physicians. And so making sure that we address, if it's present, is depression. And so making sure that we not only take care of the mom during birth, but make sure she's cared for in that postnatal period, make sure we screen for postpartum depression. Medicaid previously only covered up to 3 months of postnatal care for a mom. And I think recently the Texas legislature recently expanded that.
The bonding that you have with your mother when you're first a baby can really affect the way that you develop just socially, your brain develops, everything. And so I think that we need to be looking at how we can teach young mothers how to better bond, teach young fathers how to better bond, the closeness, the contact.
I honestly believe if we're going to change all these healthcare outcomes, access to prenatal care, healthier kids being born, educating our kids, is we are going to have to put the same intention and the same investment that happened back in the 1930s, and we have to do that now in these neighborhoods also.
So we know there's an immense amount of brain development and growth that happens from 0 to 3. And by the age of 5, 90% of a child's brain has developed, resulting in long-term implications in a child's success in school and later in life. Here in San Antonio and really across the country, we're experiencing a crisis in childcare, not only related to access and availability, but also qualified workforce. And when we don't provide fair and competitive wages, it's hard to retain qualified early childhood staff. We have areas in our county where there are not available childcare spots or not even childcare facilities within miles of a family's home. And not only access to availability to spots, but also affordable childcare. As a mom that doesn't have access to care, we risk putting our children in dangerous situations with unqualified individuals or people who don't know anything about child development or how to keep children safe. So it starts with engaging families and ensuring that families know what resources are out there. It also starts with early identification. We want to ensure that children are ready for kindergarten and that they have the skills and knowledge that will ensure that they are ready.
It's one thing if you know that there's something wrong and you're looking for help, but when you don't even know what to ask, where the help is, or what the problem is, then that even makes things more complicated. When a child is suspected to be on the spectrum, we don't even have enough therapists or counselors that can do the testing to even figure out if that's what's going on. So we can't even identify whether they're neurodivergent or on the spectrum early enough, then they can go down through school, through elementary school, and we have not identified that as an issue.
Barriers to kinder readiness include access to things like healthcare and quality early childhood education, access to qualified early childhood professionals, and those secure, trusting relationships with caregivers. We're seeing more children vulnerable in one or more areas on our EDI instrument. We're seeing children that lack language skills. We're seeing children that lack social skills.
I know in the child protection courts, we talk about kids having the ECI evaluation. They do an evaluation of children that are actually in care. We need to be as good at that with children who are not in care. So like if they're still in their home of origin, they can get those evaluations, because then they put together supportive services to address those needs so that they can be ready to be in a school environment. They might not know to, or might not have been taught to read to their children or prepare their children for kindergarten. Or maybe it's an economic thing. They're working an hourly job and they're not home at night. I think if you send a child to school happy and healthy and ready for kindergarten, that child is going to have an outlook that makes them happy and healthy and ready for first grade, for second grade, and all the way down the road. And so I think it is really, really important that that foundation is laid when they're young, and that if it hasn't been, that we get in there as soon as possible and help walk alongside whoever their caregiver is to help lay that foundation.
On behalf of United Way, our impact partners, and countless volunteers, thank you for your support.